Hi there, I wanted to guide you through what's in the health journal. So when you open it up, you'll be able to obviously write your name down, but I wanted to give you an overview of what's going on in the journal. So the first part is going to be helping you understand how to advocate or stand up for yourself. And I provide you with an overview of a simple checklist to be able to arm yourself with the tools that will help you during your office visits. The next thing after that is going to be important dates and appointments. You have from January until December to schedule out and write down all of your appointments or important dates. The boxes are blank to give you an opportunity to write in how you want to see your dates structured. And then there's an easy page for you to write down questions for your doctors as well as notes. So this is going to span through December, as I mentioned. Once we're past the dates, then you're going to be able to document your medical history and care team. This gives you an overview of all of the things that have gone on with your medical history at a glance. Obviously, if you need to have more information here, hopefully you'll be able to use a patient portal or you have another place to write it down. But I find that when I have things at a glance, it makes it easier. The next thing is your allergy tracker. So if you have any type of allergies, you want to be able to write down the type of reaction, what to do, and who to contact. Which brings us to writing down any notes that you have related to this item, but we're going to continue on talking about your care team. And when we talked about your allergies and who to contact, that is going to be here in this emergency contact space. You have the ability to write down what your conditions are, who to contact, and then what doctors should you contact in the event of an emergency. If for whatever reason, either you or a loved one have to be admitted to the hospital for whatever reason, this gives you a checklist of the things that you want to consider when you go into the hospital. Obviously, if you're going to be admitted, here are some things that you want to consider. Things to help your care team. This section is important because you want to help them understand what's going on. Many times you will be able to document what are your wishes while you're in the hospital. That is what advanced directives and living will means, as well as your home medication supplements and any information that you need to be able to contact loved ones. So you also want to make sure that you're writing down all of these items related to who you are as a patient so that the care team will be able to effectively take care of you. This just gives you an opportunity to write down those things that you need to remember for the hospital. And if you have any delivery service, if anyone is coming to fix things at your house, you'll also be able to write this down, and this will be helpful for a loved one. When I discussed writing down your medications or supplements, you also have space to do that here. So you have the ability to write down your medication or supplement, how much, when do you take it, and any notes or reactions that you have. Then, anytime you have something going on, it's really important to write that down. And sometimes we dismiss it, so we don't always pay attention. So I want to encourage you to begin the process of writing down what's going on from a symptom perspective, and if you have any kind of pain. And on the bottom here, there is a pain scale for you to be able to write down what's going on. And that way you'll be able to itemize or outline that here. So you have space to write down whenever you have pain or whatever the symptoms are as it relates to what's going on with you. And there is an opportunity for you to write that down, on several pages. And I wanted to make sure that you had a lot of space to be able to do that throughout a year's time. Now, what we're going to do is get to our next section, which is our blood pressure log. This is going to be important if, for example, you have someone that has to monitor their blood pressure. You want to make sure that you're writing this down, especially if you don't have a blood pressure monitor at home, or if you go to, let's say, a drugstore and they have a blood pressure machine there. You can take your blood pressure and write this down. The other thing that we're going to look at is physical health and habit trackers. Now, this one's important because a lot of times not everyone can work with a gym. Not everyone knows what's going on here with you, especially if you're someone that hasn't been able to speak about your health goals. So this just gives you a goal setting page to really and truly write down what are some of your goals to get healthy? What are some of your goals to achieve good health? So this section gives you an opportunity to really write this down and talk about not just the positive aspects of whatever health goal you're trying to achieve, but what happens when you feel overwhelmed and how will you celebrate success. This is going to give you a workout planner. And then here you're going to be able to write down or track your healthy habits. So for example, you may have a morning routine, an evening exercise, vitamins, meditations, whatever is most important for you, you have the ability to track that. And obviously there's space down here to document what your routine is. The reason why this is important to have a routine is particularly when you are visiting your doctor or a health professional and they ask you what are some of the things that you do, you'll be able to share that with them. So there's plenty of space for you to be able to do that. Here is the information for people who have a monthly cycle. And this is basically going to give you an overview of your cycle, how long it is, and what's going on throughout the year. This is something that I was able to utilize when I was trying to work on regulating my cycle, and I'm hoping that this will be able to help you. I also did not indicate day 1, 2, 3, 4, 5, 6, 7 because I recognize that many of us have different times in terms of how long our cycles go on. But I also wanted to be able to have a space for you to recap what your cycle was like for that month, particularly if you have any pain management techniques. Do you experience PMS symptoms and what was going on in your life? A lot of times we don't recognize what happens when we have issues with either personal or career stress and how that can actually have an impact on our menstrual cycles. So that is a tracker for those things. And finally, we're going to look at food and eating habits. This gives you the ability to write down your meals for the week. You can write out things that you have for the grocery store. And then this is your food tracker. So this allows you the ability to basically write down what are you eating, how was that food made, how much did you have, and you can write down any notes here. And obviously, if you have issues with food, I definitely don't want this to trigger you, so feel free to skip this section. But if you are someone that is working with a professional and they need an understanding of the types of things that you're eating, this is very helpful. This is also something that is really helpful from an eating behavior perspective, because a lot of times we don't necessarily pay attention when we're eating. We kind of eat mindlessly. And this has been really helpful to help me understand, am I really hungry? Am I eating because I'm in a social setting, or I'm just bored? So this has been really helpful for me to really pay attention to the types of things that I'm eating, and I write down how I feel about this particular thing so that I can really expand on what I documented in that chart. And then the final section is looking at your emotional well-being. So this is going to give you some tips around sleep, around stress management, your mindset, and any notes that you have. So this has been an overview of the health journal that I created, and let me know if you have any additional questions.